Have you ever woken up feeling exhausted despite a full night's sleep? You could be suffering from sleep apnea. Sleep apnea is a serious sleep disorder that occurs when a person's breathing is interrupted during sleep. It's like a silent thief in the night, stealing away the restful sleep you need to function at your best. Symptoms can range from loud snoring and daytime fatigue to waking up with a dry mouth or a morning headache. But sleep apnea is more than just an annoyance. If left untreated, it can lead to a range of health problems, from high blood pressure and heart disease to diabetes and depression. The good news is, sleep apnea can be managed, and treatment can significantly improve your sleep quality, your energy levels, and your overall health. The key is to understand what's happening in your body and take action. Understanding sleep apnea is the first step to tackling it. But how do we do that? Before we dive into the solutions, understanding the causes of sleep apnea is crucial. Sleep apnea, a common but serious sleep disorder, has several main causes, and it's important to remember that anyone can be affected. It's not selective about who it targets. Let's delve into these causes to better comprehend this nocturnal nuisance. First on our list is obesity. Excess weight contributes to sleep apnea by causing fat deposits around the upper airway, obstructing the breathing. It's a significant risk factor, with over half of people with sleep apnea being classified as overweight. Next, we have age. While sleep apnea can occur at any age, it's more common in adults over 40. The risk increases as our bodies naturally change with age, including a loss of muscle tone, which can lead to narrowed airways. Smoking is another culprit. Nicotine relaxes the muscles that keep the airways open. If they relax too much, the airway narrows or closes. Not to mention, smoking can increase inflammation and fluid retention in the upper airway, both of which can cause or worsen sleep apnea. Alcohol use is a similar story. It relaxes the muscles in the throat and can also lead to weight gain, both of which can cause sleep apnea. Plus, alcohol tends to disrupt the normal sleep cycle, which might worsen any existing sleep disorders. Lastly, nasal congestion. If you have difficulty breathing through your nose, whether it's due to an anatomical problem or allergies, you're more likely to develop obstructive sleep apnea. These factors can work alone or in combination, creating a perfect storm for sleep apnea to take hold. However, knowledge is power, and understanding these causes is the first step towards tackling the problem. Now that we know the causes, it's time to explore how to get rid of sleep apnea. Believe it or not, simple lifestyle changes can significantly impact your sleep apnea. Now let's dive into these changes and see how they can help you breathe easier at night. First off, weight loss. It's no secret that carrying extra pounds can put a strain on your body, but did you know it can also affect your breathing? Extra fat around your neck can narrow your airways, making it harder to breathe while you sleep. So, shedding those extra pounds can relieve some of that pressure and help improve your sleep apnea symptoms. Next, let's talk about smoking. It's not just bad for your lungs, it's also a major culprit in sleep apnea. You see, smoking can increase inflammation and fluid retention in your throat and upper airway, which can exacerbate your symptoms. So, ditching the cigarettes can be a game changer in managing your sleep apnea. Now, on to alcohol and sedatives. These substances can relax the muscles in your throat, which can cause them to collapse and obstruct your airway while you sleep. By avoiding alcohol and sedatives, especially before bedtime, you can keep your airways open and reduce your sleep apnea symptoms. Last but not least, regular exercise. Not only can it help you lose weight, but it can also strengthen your respiratory system and improve your overall health. So whether it's a brisk walk in the park, a swim in the pool, or a yoga session in your living room, any form of physical activity can help keep your sleep apnea at bay. In conclusion, lifestyle changes such as weight loss, quitting smoking, avoiding alcohol and sedatives, and regular exercise can all play a significant role in reducing your sleep apnea symptoms. They can help you breathe easier at night, improve your sleep quality, and enhance your overall well-being. But sometimes lifestyle changes aren't enough. That's where medical treatments come in. So, stay tuned for our next segment where we'll help you navigate the world of sleep apnea treatment options. When lifestyle changes aren't enough, medical treatments can make a world of difference. Let's delve into the world of medical treatments for sleep apnea. One of the most common and effective treatments is continuous positive airway pressure, or CPAP. This treatment involves a machine that delivers a steady stream of air through a mask worn over your nose or mouth while you sleep. The pressure keeps your airway passages open, preventing the collapse that triggers sleep apnea episodes. It's like a gentle breeze constantly blowing through a tunnel, keeping it open. Now, if the idea of sleeping with a mask seems a bit daunting, there are other options. Oral appliances designed to treat sleep apnea can be a good alternative. These devices, similar to mouthguards used in sports, help to keep your airway open by repositioning your jaw or tongue. They're custom-made by dentists or orthodontists, ensuring a comfortable and effective fit. But what if these options aren't enough? Well, there are surgical options available as well. These procedures can range from minimally invasive to more complex surgeries. For example, uvulopalatopharyngoplasty, or UPPP, is a procedure that removes excess tissue from the throat, widening the airway. There's also the Inspire device, an implantable nerve stimulator that keeps your airway open by stimulating a nerve that controls the tongue. Remember, every person is unique, and what works best for one may not work for another. It's crucial to work closely with your healthcare provider to find the treatment that's right for you. And remember, these treatments are not a one-and-done deal. They require a commitment to use consistently and regular follow-ups with your doctor to ensure they're working effectively. And while these medical treatments can make a world of difference, it's important to remember that they are not magic bullets. They're part of a larger approach to managing sleep apnea that includes lifestyle changes and often a commitment to long-term care. Despite these solutions, prevention is always better than cure. So let's explore some preventive measures in our next segment. Preventing sleep apnea may seem challenging, but it's definitely achievable. Let's start by focusing on maintaining a healthy weight. Excess weight contributes to sleep apnea, as fatty deposits in your throat may obstruct your breathing. Keeping your weight in check can therefore help prevent this condition. Regular exercise not only helps you shed those extra pounds, but also improves your overall health and sleep quality. It doesn't have to be anything strenuous. A brisk walk around the block, a quick swim, or a few yoga poses can do the trick. Now let's talk about the importance of a balanced diet. Consuming nutrient-rich foods is essential to maintaining a healthy weight and overall well-being. Prioritize fruits, vegetables, lean proteins, and whole grains while limiting processed foods and sugars. This not only aids in weight management, but also keeps your energy levels stable, reducing your chances of sleep disruptions. Next, let's discuss the substances you should avoid. Alcohol and sedatives might make you feel drowsy, but they actually disrupt the quality of your sleep. They can relax the muscles in your throat too much, causing obstructions and sleep apnea episodes. Similarly, smoking can inflame and narrow your airways, contributing to sleep apnea. So, it's a good idea to limit your alcohol intake and consider quitting smoking. Lastly, don't forget to establish a regular sleep schedule. Our bodies thrive on routine. Going to bed and waking up at the same time each day can significantly improve your sleep quality and may reduce the likelihood of sleep apnea. In conclusion, preventing sleep apnea involves a combination of healthy habits. Keep a keen eye on your weight, exercise regularly, eat a balanced diet, avoid harmful substances, and maintain a regular sleep schedule. It may seem like a lot, but these small changes can make a big difference in improving your sleep and overall health. Remember, a good night's sleep is just a few steps away. Sleep apnea can be daunting, but with the right knowledge and tools, it doesn't have to be. We've delved into the depths of sleep apnea, understanding what it really is and how it impacts our lives. We've unveiled its underlying causes, some of which might have surprised you. We've explored the lifestyle changes that can lead to significant improvements, like maintaining a healthy weight and quitting smoking. We've also looked into medical treatments, which range from simple oral appliances to advanced surgical procedures. Many of these treatments are not as intimidating as they might seem, and they can make a world of difference. And finally, we've discussed prevention because the best way to deal with sleep apnea is to stop it from happening in the first place. So, armed with this knowledge, we can all sleep a little easier. Don't forget to subscribe to stay informed about more health topics. Sleep tight and take care.